What's going on, people? It's Justin coming at you. Happy holidays. I just wanted to make this video about dealing with difficult people, dealing with difficult patients and clients. Now, I have done a video in the past on how to deal with difficult coworkers. This one is how to deal with if you're a personal support worker and you're dealing with difficult clients and patients. Now, it doesn't matter what type of setting that you're in. You can be a home care, you can be a long-term care, you can be in a hospital. But dealing with difficult people, first and foremost, you have to analyze the type of person that you're dealing with. Now, these might be people who are overbearing. They might have some cognitive issues, or they might just be depressed in general. And the problem is you have to analyze one of these types of situations because first and foremost, you want to know exactly what you're dealing with here. So if you're dealing with a person who's just difficult all around and they're very overbearing and they've come from, kind of probably like a lifestyle or a job background where they've been in charge and they're used to giving other people orders. And then when they find themselves in a situation where they're unable to help themselves in certain aspects and they depend on you, that's when they start gravitating and, consistently nagging you for more and more and more. Now, the way I deal with this sort of thing is if it's a client who's consistently overbearing and demanding, we'll take a long-term care type setting or even a hospital type setting where you're there, you're helping your patient, and they're consistently calling you on the call bell and they say, I need this, I need that, I need that. You have to reinforce to that person that you are busy after the fact, that when you do help them, and this is how you go about doing it. Okay, so you go and help them, you get them what they need, you engage in little conversation with them, you keep things pretty businesslike, and you get the hell out of the room to do something as soon as possible, whether it be work or just go and disappear for a little bit. And you remind them that you are busy and you will come as soon as you can. And in some cases too, if the client is being very overbearing to me, I will wait out an extra 5 minutes or so with the call bell being called, even though that is kind of a little bit cruel, but you're signifying to that person that you are busy, because if you come running right away, that gives them the impression that you're not busy and that you are all theirs, basically, which is not the truth. Usually some clients sometimes have psychological problems, or they probably have dementia, Alzheimer's. It just depends. Dealing with people with dementia, Alzheimer's is a little bit better. It's more of a redirection kind of thing. People with dementia, you sort of have to redirect and sort of have to cue them a little differently and try to get them to do a different type of task. Those type of people, sometimes you can't redirect them, and other times you can get their mind off a certain situation. Like if they're trying to get out of a locked unit, you might want to redirect them by giving them a book, or showing them like something you did, or probably engage them in something completely different that takes their mind off the situation of getting out of that locked unit. So there's an example there. But all around, dealing with difficult people, you don't want to give them too much attention in the end. You don't want to make yourself widely available, is what I'm trying to say. Engage them in little conversation. Remind them that you're busy, that you have other things to attend to, and tell them that you have some showers you're doing, or you're busy with some paperwork, and that you will come as soon as possible, and that you have other people you have to look after as well. So that reinforces to them that you are actually busy and that you are doing your job, and that you're not actually giving them the attention that they need, because they're going to draw off that, how a vampire draws off blood by sucking your neck. I'm just trying to use it as an example to throw it there at you. I actually call people like that bloodsuckers, because they're basically sucking the life out of you, you know what I mean? And eventually you're going to get to a point where you're going to blow up at them, but don't do that, you know what I mean? If it comes to a point, though, that the person is being a little bit really overbearing, tell them straight out, and I've done this a couple times, that you find them very overbearing, and that you are a very patient person, and that you have really good intentions and good manners, and that you were taught good manners by your parents. That will kind of in some ways shake them a little bit, because then they'll realize, oh shit, maybe I'm doing something wrong here. And other times they might just shake it off because they think you're full of it. But, my own parents raised me to have good manners and to have patience and to, do what I can for people. You know what I mean? If I'm being patient, to be patient with people, if they're busy, or be patient while I'm waiting in the line at the grocery store, or just be patient with, just be patient with certain tasks. And good manners. I've always been taught good manners. So I'm just throwing this out there at you all because I want you to be aware that dealing with difficult patients and clients can be really tedious, and it can take a lot of energy out of you. And at the end of the day, when you go home, you're going to feel like you're wiped out because these people are sucking off you like a vampire. Don't let that happen, and try to do what you need to do to get out of the situation. And if they're not listening to you, if you're in a hospital or a nursing home type setting, get the charge nurse to come in and talk to them. And maybe a different type of voice will shake them up a little bit if that's what they need to do. But the best advice I've always been taught is to give these people as little attention as possible. And when they do need something, complete the task quickly and efficiently and get the hell out of there, and try to keep your space from that person as much as you can. So that's my best advice today for dealing with difficult clients and patients. All right, everyone, take care. Bye for now.